Good afternoon, everyone. My name is Mary McGowan, and I'm CEO of WomenHeart, the National Coalition for Women with Heart Disease. Thank you so much for being here today to celebrate February, American Heart Month, by learning more about patient experiences living with high cholesterol and/or FH, familial hypercholesterolemia, and the impact on women's heart health. Thanks to our generous sponsors, Amgen and Genzyme, we have conducted a study among databases of WomenHeart and the FH Foundation. 795 participants completed the study, which was conducted by the Minneapolis Heart Institute Foundation. We are pleased to have an extraordinary panel of speakers today discussing this comprehensive study, the findings, the implications of cholesterol on heart health, and the experience of living with heart disease. We will also welcome members of Congress who will give their perspectives of how we can take action to improve women's heart health.
Familial hypercholesterolemia is a genetic disorder. It's inherited, and it's characterized by very elevated LDL cholesterol and a family history of premature heart disease. It's clinically recognizable. There's things that we, by taking a good history and talking with a patient, that we can decide that somebody must have or is a likely candidate for this gene abnormality. And the key to treating this is early detection and treatment is essential. That's the way we're going to reduce morbidity and mortality from familial hypercholesterolemia. The challenge, though, remains is that we underdiagnose it and we undertreat it. And for women, the unique issues are related to childbearing, pregnancy, and potential effects to their offspring. The risk is the risk for heart disease. And we see very young people having heart attacks and even dying. And often that's when they're brought to our attention.
WomenHeart is a voice at every level, and that's very important to raise awareness. We can only make progress this way, and we have made great progress against heart disease, but it still remains, as you know, the #1 killer of women. This is not a partisan issue. As you work in your local communities, it's not across party lines, it's everyone joined together. We have to support programs that educate both women and their health providers about the risk factors, about prevention, and the diagnosis of heart disease. Any step of progress is a step worth taking. Advocates like WomenHeart continue to use their voices, your voices, our voices, to push for action in Congress. The issues you champion are issues affecting real people in every single congressional district in your communities, because we don't have all the information we need to make the most of health research in the area of women and heart disease, screening, and treatment.
I feel fortunate to be alive. Although I was an active athlete, outdoor enthusiast, and social worker when I was 39 years young, in 2005, I was diagnosed with panic disorder when I complained of symptoms of nausea and shortness of breath. 3 weeks later, a 99% blockage was discovered in my coronary artery, a pretty good reason to be panicked, as it turns out. A stent was put in, plus 3 more stents just a few days later, and for my 40th birthday, I received a 5th stent. One afternoon in July, I was enjoying a hike on America's Mountain when I began to feel very sick. I woke up in the hospital 3 days later to be told that I had a massive heart attack, and due to the delay in treatment, my heart was now more than half dead muscle tissue. At age 42, I became legally disabled, forced to give up my hard-earned social work career. My personal life and social life also disappeared. The worst day of my life is living with heart disease every day. After 8 long years, I finally learned what led to my debilitating heart disease. In fact, 20% of heart attacks under the age of 45 are likely due to FH. With this knowledge and new treatment, I have also become a trained FH advocate. I flew all the way here from Colorado to highlight the urgent need to take action to detect and treat FH early. There are simple and affordable ways to detect high cholesterol and FH. Access to affordable screening, such as a full lipid panel, including identifying lipoprotein abnormalities, is crucial. Increasing awareness about the importance of knowing your family history, which I did not, is critical for early diagnosis. And finally, including more women in clinical trials will give us the information for effective treatments.
You don't find an individual with FH, you find a family. FH runs in my family. I have FH, as do my daughter, my 2 sisters, my father, and his 3 brothers. Untreated total cholesterol well over 300 is common in my family, but early diagnosis and treatment has made all the difference. As you can see in the WomenHeart survey, even among those diagnosed with FH, the rate of family screening is low. FH is treatable. Treatments for FH that have been proven to significantly lower the risk of a cardiac event are readily available. The challenge lies in making that diagnosis, screening the rest of the family, and taking action to treat FH. Number 1, we don't know enough about the prevalence, diagnosis, or the patient experience of FH in the United States, and more research is needed. Number 2, there's a lack of awareness of FH in the public and among healthcare professionals. Number 3, there is no diagnosis code for FH. The National Heart, Lung, and Blood Institute and the American Academy of Pediatrics recommend universal screening for all children between the ages of 9 and 11. I joined the FH Foundation because when my pediatrician screened my daughter and I found out that my 7-year-old had a total cholesterol over 300, I knew I had to do something to make sure that other families have the same opportunity to treat this disorder while they still have a fighting chance. With early diagnosis and appropriate treatment, my hope is that my daughter will never have to worry about heart disease.
This is all about prevention. This is all about education and awareness. This is all about us living, eating, working smarter if we're going to make a real difference. We need to share those statistics. We need to go out in the forefront. I want you to know, as a member of Congress, you have somebody who is carrying your message for you every day. I have started more than 100-member campaign that we're asking people to join us as we ask for more funding, as we ask for more information through our budget. We have a united front of Democrats and Republicans who are working together, because there is no partisan face when you start talking about health care, and in particular when you're talking about stroke survivors and cardiovascular survivors. Thank you so much for allowing me to come.